Welcome to the Amish Space Station, and today we are going to be talking about the truth of aspirin, and we're going to be getting information from what really makes you ill. The establishment definition for aspirin refers to a widely used drug that relieves pain and also reduces inflammation and fever. Aspirin is a common over-the-counter drug. It is a NSAID, an anti-inflammatory drug. It is also used as a preventative for heart attacks and strokes. Although for this preventative purpose, it is recommended to be taken at a low dose and usually under the direction of a physician. Although all experts within the medical establishment are generally in agreement on topics relating to the appropriate treatments, the Mayo Clinic webpage entitled Daily Aspirin Therapy understands the benefits and risks, makes the interesting revelation that there's some disagreement among experts about whether the benefits of aspirin outweigh its potential risks. This statement illustrates 2 points, one of which is the intriguing idea that experts do not always agree, thus challenging the ridiculous notion that science is always the result of a consensus. The other, more salient point is that it highlights the contradictory notion that a substance can be both beneficial for and pose risks to health. Some of the side effects of aspirin include gastrointestinal problems such as nausea, vomiting, and abdominal pain. More serious effects include gastrointestinal bleeding. These effects, which are not side effects, but directly result from the ingestion of aspirin, should not be surprising because aspirin is recognized to irritate the stomach lining. It was once quite common for doctors to recommend aspirin for children with a fever, but it was later discovered that when children were diagnosed with conditions such as chickenpox or flu, the use of aspirin to treat the fever could cause a condition called Ray's syndrome, which affects the brain and liver and is often fatal. The active ingredient in aspirin is salicylic acid, which is synthesized from a substance found in willow bark that has long been regarded as an effective pain relief agent. It is claimed that Hippocrates use it. Previous discussions have indicated, however, that a long history of the use of any substance to alleviate symptoms does not prove that it is beneficial or safe. Some of the substances used as remedies worked due to their toxic nature. An emetic is a pertinent example. It is also important to emphasize that the suppression of symptoms, such as pain or fever, with drugs will never cure the problem because they do not address or remove the underlying cause. Thank you.